This video is about feeding in hospital if you have a hospital birth, straight after that you've given birth. Obviously, most hospitals in the UK I'm speaking for, and probably most hospitals in the Western world would encourage you to feed straight away. Sometimes they take the baby away to check in America, whereas in the UK, baby's normally kept with mum, and they'll maybe do the weighing and things like that after a little bit of time. So the first skin to skin, if possible, is very empowering. It helps the baby to smell your milk and helps them to feel calmer after the shock of being born. They get to hear your heartbeat. Babies naturally try to mimic your blood pressure and your heart rate, which I'll talk about in another video. And so it's very comforting to them. Now, you might be absolutely exhausted by the time you're put in a ward, or if you have your own private room. And in hospitals, they normally encourage you to sit up and feed. The World Health Organization has talked about a sleep safe position, which I will show you in another video. However, most hospital policy would like another adult there if you're doing that, because they don't want you to fall asleep in the hospital bed with the baby by your side. When my daughter had her baby, I stayed after the labour. I must admit, I was smacking my face to try and keep myself awake because I was tired. But I stayed there so that when baby wanted to feed, I could bring the baby over to her. My daughter could lay on her side and breastfeed. And then when baby was finished, I could take baby back to the little cot or hold baby. So that's something to think about. You have someone with you during the birth, but often people go home after the birth. It's lovely if you can have someone with you to support your breastfeeding journey. In the UK, the midwives are very busy. They won't always have time to come straight away when your baby's crying, and they definitely won't have time to stay with you while you're laying and feeding. So you'll be in a position where you've got to try and sit up. You're very tired. You've just you've just given birth. And I'm not saying there's anything against sitting up or any problem with sitting up, but I'm just saying that if you have learned the sleep safe position and want to be able to still rest after having given birth, the hospitals often require that you have another person with you, and they seem happier with that you have a person with you who stays next to you, is awake the whole time that you're feeding, and can take the baby and either hold the baby or put the baby back in the cot when they've finished feeding. So if you have enough of a support system where you can have someone staying with you in hospital, that is an amazing support.